Thank you for being willing to be a preceptor in the Bethel University Athletic Training Program. Part of the requirement of being a preceptor is that we meet with you or provide some information and training in regards to our program and our expectations. So this video is to help you understand both of those. Our program director is Chad Osgood, and I serve as the clinical education coordinator. There's our contact information here in case you would need to get a hold of us for any reason. I won't hit everything in this pamphlet, but there are a few things that I want to make sure that you understand. I'm going to skip down to academic requirements. So in our graduate school program, which is a 2-year program, these are the courses that the students will take if they do the 3-2. So if they do the biokinetics undergraduate and then go on to get their MS in athletic training, these are the courses that are included in that major. If they transfer in and do just the athletic training major to receive the MS, these are the courses that are involved in that. So most of our students at this point are transfer students, so this is the curriculum that they're taking. Every semester, students are sent out for clinicals and are required to complete 250 hours in their clinical time during that semester. So part of their time with you is to complete all of those hours. The first year students are sent out on 6-week rotations, and so that year they have six-week rotations. And then our second year graduate students have a variety of plans. They might be coming out in an immersive situation, so they're out in clinical sites for 6 weeks, and they're working anywhere from 30 to 40 hours a week to get a feel for what it is to work in your facility as a full-time athletic trainer. We also have some 12-week off-campus clinicals and then some 18-week full sports season clinicals. We have a list or partial list of some of the affiliates that we have, if you're interested in looking at that. Our first year students, our graduate students, again, like I said, will have rotations, so you can get an idea of what the clinical rotations for our first years, the timing of them have already been established. The students are responsible, though, for contacting you 2 weeks prior to the beginning of their clinical and setting up the first day, time, arrival, and getting that established. During their time there, the students will have skills that they would like to be assessed on, and they will have a packet of these. On average, the skills, typically we want them to complete maybe 1 to 2 skills a week. So this is an example of the evaluation form. So a student will come and say, I'm ready to do a skill assessment. And so let's say that you chose neurological exam of the upper extremity and you wanted them to demonstrate that. So this is the evaluation scoring sheet. The first box will always have the criteria structure that we're looking for, and you can grade them anywhere from a 0 to a 6. A 0 is they didn't get any of them right. A 3 would be equivalent to a 70%, so I think that's written up here, yeah. So they would have passed that, but barely. And then a 6, of course, they did it perfectly at 100%. The last 4 components are the same in every skill that is evaluated. So we always want to know, are they doing the skill in a logical order? Do they have confidence? Are they demonstrating professionalism? And was it completed in an appropriate amount of time? So then they get a score out of 10. The 10 points. We have you write in whether this is a live or a simulated skill practice, and then you sign it, and then you can add any notes in on the bottom that you want. Um, so that you know, students have to receive a passing score on every skill sheet. So if they fail this the first time that they come to you, um, they need to repeat it until they get at least a 70%. However, the first grade that they get from you on an evaluation skill is the grade that goes in the grade book. So if a student came to you and wanted to demonstrate neurological exam of the upper extremity, and overall you scored them a 5 out of 10, that is the grade that would go in the grade book. However, they would have to repeat that skill for you at a later date and continue to do so until they received at least a 7. And I just have a couple other examples in there. This is our rubric. If you're not sure or want to know what the students should know or what they would be expected to know, we have it broken down into 4 categories. So in prevention techniques, our year 1 students at the end of the year should be able to perform these tasks. The year 2 should be able to perform these tasks as well as the year 1 tasks. And we divide those up into 4 categories if you want to look those up. Of course, the students know what classes they've had, and it's just might be as easy to just ask them where they're at in their studies. All right, affiliate site requirements. There are certain standards that we need to abide by with our affiliate sites and our preceptors. So we have those written out. They must supervise students during clinical education, provide instruction and assessment of current knowledge, skills, and clinical abilities designated by the Commission, provide instruction and opportunity for them to develop clinical integration of proficiency skills and clinical decision making, provide assessment of athletic training students' clinical integration for actual patient care, and facilitate the clinical integration of skills, knowledge, and evidence. So that is a CATIE requirement, so we need to make sure that you're aware of those. There's other ones that I want to highlight that I think that you'll be most interested in. Standard 41 is that preceptors must receive planned and ongoing education from the program designed to promote a constructive learning environment. So this notebook is part of it, and this short little video is part of it. And then we will have a time at the end of the academic year where we will contact preceptors and want to have a one-on-one meeting with them for input to our program and help answer any questions that they might have. Standard 51, the education sites must be evaluated by the program on an annual plan basis. Again, that will be at the end of the year. We do have an evaluation form, which is later in this notebook that you can look at so you know what we're expecting to find and to look at the evaluation. Standard 57, we need to publish a minimum maximum requirement of clinical hours. Our minimum is 1,000 hours, so that's 250 hours per semester, and 1,500 hours is our maximum. Students are required to have 1 day off every 7-day period. Typically that is a Sunday, but whatever works for your facility. Students are not to receive any monetary remuneration for their educational experience, so they can't be paid during their clinical, they can't take money from a patient. It's okay for them to receive a small gift as a thank you from a patient, but that would be about it. They are not to replace professional athletic training staff or medical personnel. They're there for an educational experience. Standard 63. Students must be directly supervised by a preceptor during the delivery of athletic training services. Preceptor must be physically present and have the ability to intervene on behalf of the athletic training student and the patient. So visual and verbal contact is very important. So the student shouldn't be sent out to the field on their and covering a practice or a game on their own. They shouldn't be in a room in a clinic by themselves with the patient. The preceptor should always be able to have visual and verbal contact at all times. We do carry liability insurance on all of the students. If you would like a proof of liability insurance policy, please let me know and I will provide that for you for your facility. Standard 71, the program must establish and ensure compliance with a written safety policy regarding therapeutic equipment. And we do later in this manual have a therapeutic equipment policy, which in short, any equipment that plugs in needs to be calibrated and safety checked on an annual basis. And one of the assignments for the students is that they need to see a bill of service, or they need to go around and look at the date on the stickers of all the machines that have been calibrated, and they have to report that in as an assignment for their class. Bloodborne pathogens must be posted or readily available in all locations. If those are in an electronic system, that's fine. The student just needs to have access to that. Bloodborne pathogens, the barriers and control measures need to be available. So gloves, masks, that needs to be available where they practice. So in the athletic training room, in the kit, in the clinic rooms, all those places. Standard 77 is that students need to have access to proper sanitation precautions, so a hand washing station at all sites, or if you're out on the field, there needs to be some sort of waterless sanitizing product in the kit. All students must have venue-specific written emergency action plan. So if the student is working in the athletic training room for part of the time, they need to know what the emergency action plan is in the athletic training room. And then maybe the rest of their time they're out on maybe a soccer field. And they need to also know the emergency action plan out on the soccer field. So there's actually two emergency action plans. One is for athletic training, what do we do if an athlete gets hurt in this venue or this location, the steps. And then the other one is, what does the student athletic trainer do in case of an institutional-wide emergency? Maybe it's a fire, or there is a tornado. They need to know exactly what to do in those situations. Again, this is part of an assignment that the students will have to read these, and then you're signing off that they know what to do in these situations. I think that pretty much covers that. Preceptor guidelines are on the next. The big gist of this, I guess there's two of them. One is the students need to be directly supervised in order to count any of their hours and in order to be in compliance with the KD